And usually when I adjust people's neck, I take the hat off, but today we're definitely not taking the hat off, okay? All right, nice and relaxed and loose there for me. Hey everybody, this is Dr. Brady from Kalkstein Chiropractic, and I'm joined here with Shayonna, my fellow Steelers fan here at the office. Hard to come by around this area, but we appreciate her being here. And you've been coming since beginning of April, right?
Yes.
Okay, gotcha. And it is now June 12th, so coming for a decent amount of time. And with her treatment plan, at first, she was in pain when you were in pain, right, when you first got here. So we did a lot of adjusting, dry needling for the first couple of sessions, showed her some basic stretches that she could do at home. And then I'd say, honestly, it wasn't long, 2 to 3 weeks after when you started having your pain levels decrease in intensity, we got you out there on the exercise floor. And yeah, she's been crushing it ever since, doing at-home workouts, feeling good, right? What are we dealing with here today?
My lower back. My knees aren't so bad today, but definitely my lower back.
Lower back.
Do some adjustment.
Okay.
Yeah.
Is it more stiffness, pain?
Yeah. So like when I'm sitting in a chair for a long time, I definitely notice I have to use a lumbar support because if I don't, then I am in a lot more pain.
Okay.
So that is what I'm feeling.
Do you use it all the time when you're working?
Not all the time.
80% of the time?
Probably about 80, more like 70.
70? Okay.
So it's very noticeable when I don't use it.
I gotcha. Have you been better with it though?
Yes.
Than your first, okay.
Yes.
Yeah, it takes time. Yeah.
Yes.
All right, well, right now what I want to do is just a re-exam, see where you're at. 1, let me know pain, discomfort. 2, if it's focal to that area or if it travels down the leg, anything like that then, okay? So first one, hardest one here, especially in the morning, go all the way down and try and bend over and touch those toes. Good. 5 off then, Eddie. Shout out to Eddie, he's our documenter here today. And you can go ahead and stand on up. Perfect. And then all the way back. Good. 10 off there, Eddie. And then go ahead and cross on up just like this, giving yourself a big old hug. Gonna do that same thing for me. Bend over. Yep. I'm gonna go ahead and drop this shoulder, and then I'm gonna load that joint. Good. Any pain or discomfort there?
No.
Any pain or discomfort there? No. All good? Good. And then go ahead and bring your hands together like this here for me, and now rotate to your right as far as possible. Good. Full. Any pain or discomfort at all? No? And same thing on the other side. Good. Good. Full. Did they feel about the same, equal on both sides then?
Yeah.
Good. All right, let's go on to your back here. Let me do a few more tests before I adjust here today. Nice. Do you mind telling people what you do for a living?
I'm a therapist.
Nice.
I'm a social worker.
That's awesome.
Yeah.
How long have you been doing it?
I've been licensed for a little over 2 years now.
2 years? Okay.
Yeah.
Nice. Oh, and by the way, fellow Pennsylvania native as well. So, any pain or discomfort at all in the hips?
A little bit of tightness around right here.
Right in the adductor groin? Okay. But no numbness, tingling, anything like that?
No.
Good. By the way, I was up in Scranton last weekend. Yeah. Just camping up a little bit north of Scranton, like on the line.
Did you have a good time?
It was a great time. Yeah.
Well, camping is awesome.
It is.
I love it so much.
The rain was, I mean, it's been raining all the time.
If it's not
It's still fun.
storming, then it's good.
Not happy with that.
I could definitely feel the tightness.
Okay. In the nerve. Okay, so does it feel like sharp shooting?
Underneath, it's like a sharp, like it's definitely tight.
Tense. Okay. It doesn't go down to your toe or feet or anything like that?
No, it's all in my leg right now.
Okay. And it doesn't feel like a stretch like the other side? Okay.
It's a pulling.
Pulling sensation. Okay. Any headaches or anything like that here lately?
No.
Good. And usually when I adjust people's neck, I take the hat off. But today we're definitely not taking the hat off, okay? All right, nice and relaxed and loose there for me. Good. Drop that right shoulder. Good. And same thing with the left. Good. Nice. Okay, I'm just gonna move this here so you give it a shot. All right. So what you got going on today?
Work today.
Yeah.
That's about it, honestly.
Anything for the weekend?
I have graduation for my niece.
Nice. Local or up in PA?
Yeah, local.
Gonna push you a little bit.
That's okay.
Show the people in the video the progress you've been making. Nice. Good. All right, let's go onto your side facing me here, please. Good. And you feel like you're getting stronger?
Yeah.
Week by week?
Definitely.
Yeah.
And when I reached my toes, the first thing you had to do, prior to coming, I probably wouldn't have actually been able to do it, even though that wasn't probably the furthest. I probably wouldn't have been able to.
Yeah. That's good. And we're a team here. It's not just us, you know. You're putting in the work outside of the office too, so. All right, nice deep breath in, and then all the way out. Nice and loose, just gonna roll you right through here. Yep. Good. And then same thing on the other side for me. How we doing over there, Eddie?
Oh, doing great.
Good.
Well, living live.
Good.
Living live.
All right, deep breath in, and all the way out. Right through here. Yep. Good. And let's go up here. All right, and then we'll go face down. All right, just because of the nature of her job, there's a lot of sitting involved in your profession, right?
Yes.
So do you sit through hour-long appointments typically?
Yes.
Okay. Is it something that like gets worse as the appointment goes on, like a build-up, or is it just kind of stay at a plateau for you? You know what I mean by that, like intensity?
Yeah. It varies. It doesn't stay consistent.
Okay.
If that answers your question.
It does. Just depends on the day, right? When you're using that lumbar support, it's a little bit better. That's 70%.
Yes.
Turn
That's
that
my
70 to
honest answer, though.
yeah. No, I like it. Just got to get on you a little bit. All right. So another thing that I do with her is I really am feeling the musculature that surrounds the lumbar spine. And I always tell her, you know, let me know when I'm like a 6 out of 10 on the intensity scale. Like I don't want to exceed that because she'll just tighten up and not really allow the tissue to relax and let me sink in to those muscles. So right there I could tell I was going a little bit too hard. And if this video wasn't on, she'd be yelling at me right now. All right, there's a couple muscles that I'm working on. So I'm working on the lumbar erectors, the muscles that go on either side of the spine that help support the lumbar spine. And then also into QL, so the muscle that attaches from the hip to your 12th rib up here. And then the last one right there at the top of the glute. So a lot of people with desk jobs, they have a lot of hypertonicity or trigger points in these muscles here. Just listen to my voice, all right? Don't even focus on that. So for the glute one, what I do usually is I'll use my elbow and then I'll take her through the range of motion. So passive range of motion. So I'm doing all the work here. She's just relaxing, thinking about the beach. Or Aaron Rodgers. Yeah. Good. Are they going to be able to hear Harry Styles singing?
Maybe.
We have to buy the rights to that. All right, nice deep breath in. And all the way out. Good. All right, got one more here for you today. If you can stand right where I'm standing with your hands interlaced like this on top of your head. Sorry, I just realized I have pain on my hands from the shed. Okay, so up on top of your head. Yep. And relaxing your shoulders. Good. Deep breath in. All the way out. And fall back here with me. Good. There it is. Awesome. All right. So now, you know what time it is. It's time to work out and get after it. Yes. I mean, you're a trooper, getting adjusted, workout all before work here today.
Yes.
Is there anything else you want to say to the camera?
Go Pitt.
That's what I love to hear.
Yeah.
All right, guys. Thanks for watching. See you next time.